Hi, my name is Julie Ponto, and I'm a professor of nursing at Winona State University in Rochester, Minnesota in the United States. And I'm here at IMON 2019 to talk about oncology nurse navigators. Oncology nurse navigators are a growing, expanding role for oncology nurses to help patients and families find their way through our very complex healthcare systems. So as we know, oncology care has gotten very complicated and often requires patients and families to see their providers in multiple locations throughout our healthcare systems. They might see an oncologist in one building and then go see a surgical oncologist in another building, and maybe go somewhere else yet to see a radiation oncologist. And so the oncology nurse navigator role has been created to help patients and families overcome some of these barriers to timely and effective care for their cancer diagnosis. So oncology nurse navigators is really based on a model whereby the nurse can assist the patient in any phase of the cancer diagnosis or treatment. So some oncology nurse navigators work with patients right from the time of screening and diagnosis, and then follow them through treatment, through post-treatment, even survivorship and end of life. So different institutions use nurse navigators differently, and you might think about using a nurse navigator for particular cancer diagnoses. So in the United States, it's common to incorporate the nurse navigator role for some of our more common frequent cancers. So for example, breast cancer, prostate cancer, lung cancer, are common cancers where we've incorporated a nurse navigator role to help those patients and families get from their treatment areas to the other providers with their multidisciplinary care. We also use nurse navigators for age-specific cancers. So for example, we might have a nurse navigator dedicated to adolescents or young adults with cancer, because we know that adolescents and young adults have very unique needs related to their cancer diagnosis. They may need help with their changing social roles, their self-image, going through cancer treatment, even continuing their schooling during treatment. And so nurse navigators can help those individuals overcome some of those issues and barriers. We have also found that there are a number of barriers to timely and efficient care. So we were experiencing long delays from a patient being diagnosed with cancer to when they actually started treatment. So some cancer centers are using nurse navigators to help address what the barriers are, whether they're internal to our system or if they're external within the patient and family life. Maybe the individual has a job where they're not given time off to go to treatment, and so they don't want to lose their job, so they choose their job over coming into their cancer treatment. So nurse navigators can help deal with employment issues, transportation issues, social role issues, and they can also help the patient's caregivers and support the caregivers in providing support to the individual with cancer. And then we also use nurse navigators at specific times during a cancer journey. So we might have navigators that focus specifically on the screening and diagnostic period, and then navigators that focus more on the treatment and post-treatment period. And so whichever model you choose to incorporate nurse navigators, some of the critical activities that nurse navigators complete are helping individuals better understand their cancer diagnosis, helping with decisions about their treatment and about their care, and helping to communicate those preferences to their care team so that we better understand what the individual needs and preferences are for patients and their families. So the nurse navigator role is really a great opportunity to improve efficiency and improve the patient experience so that our patients and their family members are more satisfied with care, they're more engaged in care, and they really have an active role in the care that they receive so that they can adhere to our treatments fully and participate in that care. So I hope you'll consider how you might incorporate nurse navigators in your systems. And if you want some more resources, the Oncology Nursing Society in the US has published a Oncology Nurse Navigator Competencies document that you might find helpful. So thank you. I appreciate your listening to the role of the Oncology Nurse Navigator.